Welcome to The Backstory, a podcast from the North Dakota News Cooperative that takes an in-depth look at the stories we're reporting for you. I'm Sabrina Halvorson, CEO of the North Dakota News Cooperative. Joining me is Michael Standaert, our lead reporter. The story we're talking about this week is titled, North Dakota Well-Positioned to Deal with Proposed Medicaid Changes. When we're talking about the Medicare story, that was one that you and I were both really interested in. And some of the things you found when you researched it surprised me because I think we were both going into this expecting for us to find problems that could really be detrimental to our rural hospitals. But as you did your research, you actually found that it wasn't as bad as we were thinking.
Yes. So when I first started looking at what they're proposing to do with Medicaid, I'd seen a lot of stories about rural hospitals closing, people cut from Medicaid, this sort of thing. So I started to look into it, and then you have to see actually what comes out in the language of the bill at the end, too. Most of what it comes down to for North Dakota is the work requirement rules that they've put into place. And from what I found, only about 10% of the people that are on Medicaid are in that 19 to 64, 65-year-old age bracket that are able-bodied and able to work. So there might only be about 10% that would meet those requirements. And then there's also quite a few exemptions. Tribal members are exempt. Let's see what else. Foster youth, pregnant women. There's a number of other exemptions too. So that 10% could even shrink further down to maybe 5% in the state. Yeah, it was surprising. And I thought there might be more pressure on hospitals in areas where there were higher rates of Medicaid coverage. So there's 3 counties in the state with high rates of Medicaid coverage: Sioux County, Rolette, and Benson. And, considering that the tribal exemption does exist, those areas, hospitals shouldn't be impacted as much as one would think. There's a 40%, I think, in Sioux County are on Medicaid, and I think it's around 36%, I think, in Rolette. So one hospital I had seen up there, Presentation Medical Center, has I think a 30% of their patients are on Medicaid. So I thought that place would be impacted most. But with those exemptions, then there's probably not as big an impact on them. There are still some concerns, though. People do have concerns about what could come down the road. This could be a program over a decade for reducing Medicaid in some ways. So there's concerns that anytime anyone is removed from the health insurance that they have, what are they going to use? And in some cases, if people don't have that, they might just use emergency rooms when there's a big problem, or they might have chronic diseases that are not attended to.
Do you recall talking when you talked with some of the people who you interviewed, and it was mentioned in the article too, but what kind of problems can arise when people have to use emergency room services rather than being able to just go to a regular doctor because of insurance reasons?
Yes, a lot of the healthcare policies that we have in place now, you can have wellness visits, you have annual checkups, see a doctor more regularly. So, if you kind of lose care, or if you withdraw yourself from care, chronic conditions and chronic disease can be left untreated. And then when something gets to an emergency level situation, then people have to go into the emergency rooms, which blocks those emergency rooms for other real emergencies as well. They're all real emergencies, but it just creates more traffic at the emergency room. So that's a concern that's out there. But again, I think North Dakota, and from what a lot of the hospital people and the long-term care people had said, North Dakota is pretty well placed to deal with the changes that are in this one big beautiful bill for Medicaid, and that not as many here would be impacted as in some other states. One aspect of that is the provider tax system, which North Dakota doesn't use for hospitals and long-term care facilities, and many other states do. So that's a way for the state and those hospitals to get extra revenue into those hospitals to help cover Medicaid costs. And then the federal government will match it to a certain rate. There's different rates for different states, and they've all negotiated some of these things over time. North Dakota's never bought into that plan. The only thing that could potentially be detrimental from that is that it doesn't allow North Dakota to do that in the future if it wanted to. I know there's been some discussion in the past, but it's never reached a level where they said, yes, we want to tap into this system.
So, looking at this from a reporter standpoint, that was something that I thought was also very interesting in this article was that it took a different shape than what we had anticipated going in. And as you did your research and you wrote the article, it went a little bit in a different direction. And as you and I were discussing it through our emails and things, one of the things that I had said was that this is good that we can represent these facts and bring in a factual article out without fear mongering, which can sometimes happen in news because we're trying to keep such a close eye on what's happening in our communities. So, when you're looking at this from a reporter's perspective and you have to shift a little bit because it's not what you expected, is that what goes into that as a reporter? And is it hard to do?
Yeah, the story was written in a different way up to the about the 11th hour. And then when the bill came out, and I was actually able to see what changes were made and speak with people and see about the exemptions. I think the exemptions part of it is an important aspect of it too. So people that won't have to go through the work requirements system. And so you just kind of have to change as you go. I had written a different lead and a different headline, and I changed it toward the end because it didn't seem that what my initial thought was had any real basis leading that way. So I had to totally shift the story.
Does that throw you off? I know that you're a very seasoned reporter, a professional. You've done this on several continents, not just in several places, but is it hard to do?
Not really. You just have to shift gears. I've had that happen in several cases before. And sometimes if you're doing daily news, this will happen more frequently when, something will come in or you'll speak to somebody else and you'll get a different idea on the story. And then that will change your story. So you just have to the roll with the punches on that and shift gears and try to represent everything as accurately as you can.
Because ultimately that's what matters is making sure that people have correct information
Yeah.
and not just clickbait or
Yes, because early on, I had seen a lot of stories about rural hospitals closing, and this may still be a situation in those states where there's a greater impact, but it just didn't seem to be the case for North Dakota. And then I had a very long conversation with this gentleman from the Healthcare Quality and Payment Reform organization out of Pittsburgh, and he kind of walked me through what are provider taxes. I didn't really know much about this before. I'm not a healthcare reporter on a daily basis. You kind of have to learn these things as you go. And then he helped me understand a lot about what was going on with the changes and how they potentially could impact facilities here in North Dakota. The story was more about, okay, what's the impact to hospitals and long-term care first? There could be another story to do later about how people are using this new system. That could be another story down the road is how people are adapting to the work requirements system. But he was able to explain a lot of things and how these changes might impact hospitals. And an important factor in that was exactly kind of what the rate of Medicaid patients at the hospitals are. And another part of that is whether those hospitals are in debt or losing money to Medicaid. So all those factors do go into place. And the ones that I identified in the stories are probably the ones that were most exposed to potential impact from losing Medicaid patients. With the exemptions, I don't think that's going to be the case in those areas. So I think there probably is something that could be done in the state to help with some of the work requirement aspects. So for the new rule is 20 hours a week of either work, volunteer, or school. So there's going to have to be some kind of program available to get those people who might be falling off of Medicaid into either study or work or some kind of volunteer activity so that they don't lose that health care.
is this one of the stories that you will continue to keep an eye on and follow up later if needed?
Yes, no, it's very interesting. I'd be really interested to see what happens down the road. And another aspect of this too is the Senate might change a few things as well. And once it goes through the Senate, so we'll have to see exactly what comes out of this one big, beautiful bill in the end.
Yeah.
Yeah, one thing I had followed before in a previous story was the impact of some rules that had come out during the Biden administration about long-term care facilities having to have certain staffing level requirements. This bill has put a moratorium on this, so those facilities won't have to comply with that for now. So they could have to comply with this in the future, but for now, they don't have to comply. And this was a big issue several months ago because the facilities were concerned that they wouldn't be able to meet those staffing levels no matter what, just because of the workforce challenges in the state.
That's interesting because then we run into the question of what happens if they can't meet those requirements. And like you said, workforce issues, that's not easy for anybody to remedy in the state.
No.
Yeah, interesting. Okay, so that's something that you'll keep an eye on too then.
Yes, definitely.
Yeah. And that story again was titled North Dakota Well Positioned to Deal with Proposed Medicaid Changes. You can read that story on our website at newscoopnd.org or in one of our local newspaper partners. For the North Dakota News Cooperative, I'm Sabrina Halvorson. This has been The Backstory.